When we're talking about stage 3 melanoma, we need to think about two groups. One, the microscopic, meaning the patient underwent a wide local excision and sentinel lymph node biopsy, and the pathologist saw the melanoma inside the lymph node, but the scans were fine and there was nothing found on the scan on physical exam. That is what is called microscopic stage 3. It represents approximately 80% of the people with stage 3 melanoma that we see in the clinic. Now, the other group is called macroscopic, meaning the patient presents with a lump or presents with an abnormal scans that found a spot in the lymph node area. That is called macroscopic, meaning it was detected on physical exam or it was found on imaging. These people with macroscopic disease, they represent 20% of the people with stage 3 melanoma. They need to be treated with 2 cycles of immunotherapy, ipilimumab and nivolumab, for 2 cycles. We give it every 3 weeks, and after that they undergo a completion lymph node dissection. If the results from the pathology report showed no evidence of disease or near complete response or near complete response, meaning less than 10% of melanoma cells are still there or no melanoma cells are there in the specimen, these people don't require anything. Imagine just like 6 weeks of treatment, including both 2 cycles of immunotherapy and the surgery, and the treatment is done. If they do have still residual disease, meaning partial response or no response, then partial response anywhere between 10% to 50% melanoma cells, or no response more than 50% of the specimen has melanoma, these people would still require to complete a full year of immunotherapy. That's for macroscopic. For microscopic, meaning the other group that was detected in wide local excision and sentinel lymph node biopsy, these people represent 80% of people with stage 3 melanoma, and they will continue to have 1 year of treatment with either immunotherapy drugs like Opdivo or Keytruda, or if their melanoma harbors the BRAF mutation, they can take targeted therapy, drugs like the dabrafenib, trametinib, or we call it Tafinlar and Mekinist. They need to take that for a full year as well. I just want to make the distinction, like the NADINA trial apply only to 20% of the population with stage 3 melanoma, and these are the people who present with abnormal scans, or they present with lump that they can feel or the physician can feel. So this is sort of the landscape of treatment of stage 3 melanoma after this wonderful results we got yesterday in the ASCO, the results of the NADINA trial.